All right, welcome back. We're going to talk about blood vessels now. So there are three types of blood vessels in the body. We have arteries that carry blood away from the heart. Arterioles are smaller arteries that lead to capillaries. So capillaries then are where gas exchange, nutrient exchange occurs. And then these lead to venules, which are small veins that lead to larger veins. And veins always carry blood back to the heart. Hello. Why does this do this? There we go. So if we look at an artery or a vein under a microscope, you can see that there are three different layers. What I always like to look is that arteries are much thicker. You can see three layers. There's 1, 2, 3. Veins are much thinner. They have a much thinner tunica media than the artery does. So the tunica intima is the innermost layer, and it's a layer of endothelial tissue, so basically epithelial tissue with underlying areolar connective tissue surrounding it. Then we have the tunica media. Tunica media contains smooth muscle. So smooth muscle, and then we have elastic connective tissue also within both arteries and veins in that tunica media. But the artery is much thicker. The tunica externa then is mainly dense irregular connective tissue. Okay, and so it's an outer layer of tissue that protects the both the artery and the veins. And here you can see the tunica externa, tunica media, and then tunica intima. And over here, tunica intima, tunica media, and tunica externa. Okay. Capillaries only have that tunica intima. They just basically have the endothelial tissue with areolar connective tissue surrounding it. That's it. So structurally, arteries are much thicker, and they have a stretchier tunica media than veins. So they can withstand a lot more pressure than veins can. Veins have a much thinner tunica media than arteries because they have less pressure. Arteries are taking blood directly from the heart. When you have high heart pressure in the ventricles, that's what pushes blood into the arteries. Veins, on the other hand, are farther away, and they're bringing blood back to the heart. So they're not under high pressure. So they actually have valves within them that allow them to move blood from one area to the next, and then they shut so that blood can't go back down. So right here you can see a valve in the vein. So I just went back a picture so you can see that valve. So because it's lower pressure, as blood moves up, because the pressure is so low, if the blood stops moving, it can pool back down, but it closes that area. And then blood will move up further and further, and it just keeps moving in one direction towards the heart. And so we use a skeletal muscle pump to actually milk blood back to the heart. And so this is what skeletal muscle kind of looks like, what it does. Every time your skeletal muscle contracts, it helps to push valves open and blood towards the heart. And then when they relax, those valves close, but the blood doesn't go back down because the valves close, so it can't go back down. Capillaries, on the other hand, like I said, only have that tunica intima, which is a single layer of epithelium with a basement membrane of areolar connective tissue. Capillaries aren't individual. They are found within what we call beds. So they are networks of capillaries that work together. And some, at any given time, only about 5% of our capillary beds are going to have blood in them. So you're only going to be feeding different tissues a few times throughout the day. So you're not feeding them every single time the blood flows through our body. We don't have enough blood in our body to fill all of our capillary beds. So we fill certain capillary beds, and then the next time that capillary bed will basically be shut off, and blood will flow to another capillary bed. And so, hold on, I'll show you what a capillary bed looks like here. So here you have the terminal arteriole, and then here we have precapillary sphincters. These sphincters will tighten when we're going to close the capillaries off, and then the blood will just run through this thoroughfare channel right into the veins, okay? But when the capillary is opened, then blood is going to perfuse the tissues. And then as blood perfuses the tissues, it moves into the venous side and eventually to the venules. So here we have the veins or the capillaries open. Here's what it looks like when they're closed. So we basically are moving directly through that thoroughfare channel, and we're not feeding those tissues. So at this point, you should be able to tell me what the 3 types of blood vessels are, structurally, how do they differ, and what is a skeletal muscle pump? All right, I'm going back. Sorry, I had to stop for a second. So let's talk about the different arteries in the systemic circulation. The first artery that branches off the heart is the aorta. This is the largest artery of the body. And I'm going to go to the next slide so I can talk about it and you can actually see it, okay? So here you have the aorta. The aorta takes blood from the left ventricle through the aortic semilunar valves, and then it moves the blood through the ascending aorta, through the aortic arch. Back here you'd have a descending aorta, and eventually down here it would be the thoracic aorta, and then right here you'd have your diaphragm, and the aorta would move through the diaphragm into the abdominal pelvic cavity. So this is a very long and a very strong artery. Here you can actually see the ascending, the aortic arch, the descending aorta, and then blood flows all the way down through the thoracic and then the abdominal pelvic aorta. Down here, the aorta will branch off. And so there's a lot of branches, as you can see, off of the aorta to feed the different parts of our body. So branching off the aorta, the first branch is the right and left coronary arteries. These serve the heart. They allow the heart to actually get its nutrients. And so you can kind of see, it's a hard picture to see, but you can see the coronary artery coming off right here. And there's a right and a left coronary artery that help to feed the entire heart, okay? So then we have a brachiocephalic trunk that splits into a right common carotid artery and a right subclavian artery. We have a left common carotid artery and a left subclavian artery also that branch off. The left common carotid artery will eventually branch off into a left internal and external carotid. The left subclavian artery will eventually branch into a vertebral artery and axillary artery, okay? So let's look at these arteries now. This is your brachiocephalic trunk. The brachiocephalic trunk will eventually branch off into a right common carotid artery and a right subclavian artery. Then you have the left common carotid artery, and you have a left subclavian artery. Off the left subclavian artery, we have the vertebral artery, And as it passes through, it becomes the axillary artery. And then as this moves into the arm, it becomes the brachial artery. So just like roads change names as you go from one area of a city to another area, as blood vessels move through the body, they oftentimes change names to the region of the body that they're at. So if we go to the thoracic branch, if we go into the thoracic, you can see arteries that branch off the aorta. We have intercostal arteries that supply the thoracic wall. We have bronchial arteries that supply the lungs, esophageal arteries that supply the esophagus, and phrenic arteries that supply the diaphragm. These aren't shown, but they're still important arteries. In the abdominal aorta, we have a celiac trunk. This is the first branch off of the abdominal aorta, and that celiac trunk branches off into a left gastric artery that supplies the stomach, a splenic artery that supplies the spleen, and a common hepatic artery that supplies the liver. Next, we have a superior mesenteric artery that supplies the small intestines and part of the large intestines. We also have an inferior mesenteric artery. So here you can see the thoracic aorta coming down, and then it moves into the abdominal pelvic aorta. Here you see the celiac trunk. There are 3 branches off of it, and then it moves down. Here is the superior mesenteric artery. And then you see these ones, which I didn't talk about yet, but these are renal arteries supplying the kidneys. And actually down here, you see these little ones that are coming off. Those are gonadal arteries. And this little blood vessel right there, that's the inferior mesenteric artery. So I just talked about these, but we have the right and left renal arteries. Then we have the right and left gonadal arteries. And we have the inferior, or the, inferior mesenteric arteries, which I'm not talking about yet, but we do have those as well. We also have lumbar arteries that serve the abdominal wall. So here you can see the renal and the gonadal arteries again, and there again is that inferior mesenteric artery, which we haven't talked about yet. There it is, inferior mesenteric. I knew it was going to come up. Serves the large intestines as well. We have a left common iliac artery and a right common iliac artery that branch off from the aorta, and the aorta is no longer there once we get into the iliac arteries. These serve internal iliac, serve pelvic organs. The external iliac serves our thighs, and then moves into and becomes the femoral artery, popliteal artery, and anterior and posterior tibial arteries. So here's your iliac, and as it moves down, it becomes, so this is a common iliac artery. Then we have an internal iliac artery and external iliac artery. As this moves down, sorry, I clicked. It becomes the common, or it becomes the femoral artery. And this femoral artery, eventually when it goes by that patellar area, becomes the popliteal artery, and then it splits and becomes a tibial and actually anterior and posterior tibial arteries, which will then eventually feed the feet. And so here again is all the arteries. You can see the brachial artery. I don't think I mentioned this, but it branches off into our radial and ulnar artery, and these feed the hands through the superficial and superficial palmar arteries and the digital arteries. So there's a lot of veins also that bring blood back, and most of these veins are going to be named the same as those arteries. All the veins bring blood back to the inferior or superior vena cava, depending. And so here we have that superior vena cava, and here's that inferior vena cava, bringing blood back to the heart. And so if you're looking at the different veins, and hold on one second. I'm actually going to stop here because I'll do the veins in the next video, and this has been a 15-minute video. I don't want to go too long because I like my videos to be short so that you can take breaks in between. All right, I'll talk to you later. Bye.